In the past decade, drowning has claimed more than 2.5 million lives. So what are the scenarios which can lead to drowning? Unsupervised children in the swimming pool, fisherfolk in unsafe watercraft, flood-related disasters, mass casualty events due to capsizing of overcrowded ferries. Why is water safety so important? Death and injury from drownings happen every day in home pools and hot tubs, at the beach or in oceans, lakes, rivers and streams, bathtubs and even buckets. Drowning is a major public health issue that can be prevented. Do you know that globally the highest drowning rates are amongst children between 1 to 4 years, followed by children between 5 to 9 years. Drowning is the third leading cause and of all unintentional injury related deaths. Around 236,000 annual drowning deaths worldwide. In the WHO data, Western Pacific region children aged between 5 to 14 years die more frequently from drowning than any other cause. Let's look at some data here. Globally, over half of all drowning deaths are among those aged under 25 years. Drowning rate in low and middle income countries are over 3 times higher than in high income countries. Males are twice as likely to drown as females. Alcohol use around water is an important risk factor for drowning in many countries, especially for adolescents and adults. And here are some more data. Around 372,000 people die from drowning every year. The drowning death toll is almost 2/3 that of malnutrition and well over half that of malaria. Drowning is one of the 10th leading causes of death for people aged between 1 to 24 years in every region of the world. There are approximately 42 drowning deaths every hour, every day. Drowning is truly a neglected public health issue which needs targeted attention. The percentage of global drowning deaths occurring in low and middle income countries is at high as 91%. Some of the scenarios which can lead to drowning: lack of basic physical barriers between people and water, unsupervised children, lack of safe water crossings, lack of water safety awareness, traveling on overcrowded ferries, flood disasters. So where are the risks? Collecting water, living near water, flood disasters, traveling. And let's look at some of the prevention strategies. First and most important is to improve community infrastructure. Increase public awareness. Have appropriate policies and legislations. Invest in research. Installing barriers controlling access to water, providing safe places away from water such as creches for preschool, children with capable childcare, teaching swimming, water safety and safe rescue skills. Setting and enforcing safe boating, shipping and ferry regulations, improving flood risk management. Pathophysiology. Submersion, reflex laryngogasm and apnea, loss of consciousness and water aspiration, pulmonary edema, intrapulmonary shunt and VQ mismatch, hypoxia, brain damage, cardiac arrest, and now let's look at some of the treatment. CPR tops the list. What are some of the global strategies adapted? Implement proven drowning preventing strategies tailored to their own circumstances, improve data during drowning, develop national water safety plan, establish global partnership for drowning prevention. This year, let's do one thing to prevent drowning. Turn the tide to save lives. World Drowning Prevention Day, the 25th of July 2022. Let's look at implementing some solutions. What solutions can we offer? We should focus on 6 areas: life jackets, water safety and swimming lessons, lifeguards, rescue and CPR, pool fencing, public health surveillance. We must provide a strategic framework for collaborative efforts to prevent drowning, guide relevant partners in a cohesive response to drowning risks, set priorities and coordinate actions among stakeholders to protect against drowning, identify important gaps in drowning prevention and water safety research, establish equity and inclusion in water safety and aquatic activity opportunities, foster targeted drowning prevention efforts for high-risk populations and environments. Raise awareness of ways to stay safe in and around the water. Address priority research questions with well-designed studies. Here are some of our suggestions. Using of social media platform for creating awareness and teaching prevention strategies. Using wearables to track swimmers' activities in water and alert systems. We call them wearable devices. Use image processing cameras to track people in water in a large pool and see for any unwanted activity. Use underwater cameras to detect swimmers' activities in alert systems. Using augmented reality and mixed reality to impart smart CPR treatment training. Here's a look at our team.